My name is Charles Slaughter. Most people know me as Butch, that's a nickname. I was in the very first physical therapy class at UMC. My company is Rehabilitation Consultants. I started it in 1989. As a physical therapist for 45 years with varied experience of spinal injury in a rehab center, directing an apartment in an acute hospital, as well as starting a sports medicine clinic and now a private clinic, I have the expertise to provide care that other people may not be able to do and to bring in other therapists with those qualities and abilities to provide home health as people normally think of getting in a clinic or a hospital. And I think that brings a better quality of life to the patient and helps them meet their goals better. There's been a moratorium on new home health agencies, and so I don't have the opportunity. You know, it's kind of like you can't pursue the American dream because it's stopped. No one else can get in there. Not only do I have to deal with the moratorium, but even if the moratorium is lifted, then I have to deal with a certificate of need. A certificate of need is a piece of paper from the government and your competitors saying that there is a need for another medical provider in your community. Well, the moratorium on home health agency in Mississippi has been for almost 40 years, which completely prevents anyone from opening up a home health agency now. And I just can't imagine why Mississippi would not want other people opening up home health agencies. We need more home health agencies to provide competition so that there's greater access for the new aging population, as well as driving the price down, making that better for everyone. With more providers, the patients will have greater access and more options, which would also drive down the cost of the health care, which would be great for the patients too. With the COVID-19 situation, having more home health agencies would allow for better social distancing, which could lead to fewer deaths. And then being the owner of a private outpatient clinic, some patients are reluctant to come into the clinic, so they would feel more comfortable for someone coming to the home. Getting home health care for those that don't have good transportation in rural areas would make it more feasible for them to get the care, and probably would be cheaper for them in the long run. I'm filing a lawsuit over the moratorium of home health agencies that's been around for almost 40 years to allow physical therapists to open up agencies to provide the care that's not being provided now. What we have now in Mississippi as far as home health agencies, there's been a consolidation of those previous. So you have fewer and fewer home health agencies. With the moratorium, no one can compete, and most of them are large companies that come from out of state, so you lose that local value of people knowing you and maybe even not having the same empathy or care that is performed. It's more of a business than the true health care that we want to provide. The reason that I'm passionate about challenging the moratorium and the certificate of need is that it just limits access to therapists that want to fulfill their dream, as well as it limits access and options for the people of Mississippi.